Hi YouTube, this is Care Bear. I just wanted to give you guys an update on what is going on with me. I know it's been probably a week or two since I last posted something. Today is Tuesday the 9th of March. I had my doctor's visit with the surgeon, Dr. Callery, last Wednesday the 3rd. And it was really great to sit down and actually meet with him with my file in front of him, to kind of, hear what he has to say about me specifically. I had talked with him a couple of times at a couple of the seminars and the pre-op support group that had the panel of post-oppers and stuff, and he was there as well answering questions. So I got to speak with him there, but everything was just kind of like on a generalized format. So it was kind of nice to be able to speak with him about my particular case and, what are his expectations and that kind of stuff. So it was really great to, speak with him about that. And I feel really comfortable with him. He is very thorough. Like if I would ask a question, I asked one of the questions that I wanted to know was whether or not I would be wearing the pressurized boot, kind of, they're not stockings, but they're an actual pressurized thing that go over the legs that pressure, that squeeze in intervals to kind of keep the blood flowing to prevent blood clots. I knew that other people had that done, and I just wanted to make sure that it was something that was done regularly with people. And instead of just saying yes it is, he said, well, the thing is that we use those so that because my question was, will I be wearing the pressurized stockings, he didn't just say yes. He actually clarified it so that I would understand even what I was asking. I think he probably gets a lot of people who come in with a list of questions that they could get from a book, which is how I had made my original list of questions. So not even a lot of them really made sense to me, or I didn't really understand why I was asking them. But, so he, I think, probably gets a lot of that where people are like, I don't know why I'm supposed to ask this, but somebody asked me to find out whether or not you burp your patients afterwards. And so he, instead of just answering yes or no, he goes in and says, well, I think what they mean is, do we release the gas that's put into the abdomen to reduce, excess gas after the surgery? And in fact, we suck out the air, so we don't just burp the patients, we suck it out. It's like his answers to the questions are very thorough, and he never, ever makes me feel like I'm asking a dumb question, which is wonderful, I think. Because, I've never been through this before, and just because this is his, 3,500th patient, to have the surgery doesn't mean that it's not, it doesn't mean that it's not my first time. So, okay, so I had received the letter, like I had mentioned, from my psychologist, and they had faxed it through. So that was last, I think it was the Monday prior to my appointment on the 3rd, which was the 1st. Well, that doesn't seem right. Oh, okay, that's right. So they got the letter from the psychologist, and then they turned my chart over to Dr. Callery for dictation. That's right. So once the chart was completely dictated, then they faxed over the request to the insurance company. So it was a couple of weeks ago that I received the last date from the authorization from the psychologist, and then Dr. Callery had my chart for like a week. And then on the 3rd, when I went in for my appointment, they said that they had tried to fax the request on the 2nd, which was Tuesday, and then they sent it again on the 3rd because it seemed like it didn't go through, or it wasn't received the first time they sent it through. So the 3rd was when they sent it through, and he had said, sometimes we hear back the next day, sometimes they try and take the full 30 days. He said that San Diego Physicians Medical Group, which is the group that I'm under with HealthNet, he said they rarely ever give any sort of a fight. They don't come back with, denials very often. He didn't expect any sort of problems with that, which was really, really nice to hear. And a day and 30 days is such a grand, for somebody who's waiting for something like this and who has waited for something like this for so long, it, you know, it can seem like forever. So it was nice for him to volunteer the information also, that he expected to hear from them probably within 2 weeks. So, you know, I don't know why. I mean, I was really thinking, okay, I will probably hear back from them in, you know, maybe April, very, very end of March, beginning of April, and then I'll be able to have a date for April, unless they come back saying, you know, that I have to wait the 6 weeks. I know I've said this a bunch, but, you know, I was just kind of, my hopes were for April. My, my hope was for April, but my understanding was that it probably would be June or July, just so that I wasn't disappointed, even though I know I would experience a level of disappointment if it was that late. And I actually laid down for a nap today because I was really tired, and my son has been really sick with a fever. It was 105.7 last night. He woke up in the middle of the night, and so I had to stand in a cold shower with him to try and just cool him down, which helped a lot last night. But I just did not get a lot of, I have not been sleeping really well because I've been worried about him, and I've been up with him when he's been up. So at one point today, I laid down for a nap and the phone rang, and I woke up from my nap, and I just knew in my heart as soon as I picked up the phone, it was going to say it was Dr. Callery's office. And I don't know why. I mean, it was only, you know, 5 business days since they entered the information, so I don't know why I expected it so much, but I looked at the phone, and sure enough, it said Dr. Charles Callery, and I like couldn't breathe. I was like so excited. But then there was a part of me that was really nervous that he had come back with a denial also. So I, you know, answered the phone, obviously, and it was Lisa, who's the person, you know, who does the insurance and scheduling. And so she, right off the bat, she was like, "Hi, we just got the approval from your insurance." And, you know, I was so excited. And it's funny because I feel like in her position, like, she must have the greatest job ever. I mean, can you imagine calling people every single day and giving them good news? Well, I mean, I guess it's not the greatest job when you have to call and give people bad news, but telling them that they're denied or whatever. But I would just have expected for her attitude to have been like, "Guess what, Carrie? You got approved so we can schedule your surgery." She was very professional about it, but I was like so excited, and I ran downstairs and I ran over to the calendar, and she's like, "So we can go ahead and schedule your surgery?" And I said, "You know, that sounds great. What are your, you know," she's like, "When do you want to have it? You know, when are you thinking about it?" And I said, "Well, what's your next date?" And she said March 29th, which is a Monday. And I said, "Let's do it." So I have a surgery date, and I'm so excited. So March 29th, which is Monday, they're expecting it's going to be at 1 o'clock, depending on what time the other surgeries happen during that day. You know, obviously, if they run late or anything, I don't know. But as of right now, it's tentatively for 1 o'clock. And sorry, I keep looking over at this. I'm looking at the calendar behind you because I have a bunch of things written on it. So today is the 9th. I have a pre-op appointment with Dr. Callery that my husband must attend on the 17th, which is next Wednesday. YouTube burp, gotta have it. Sorry about that, you guys. I noticed nobody ever comments on whether or not they laugh at the fact that I burp in every single video, or whether they find it annoying or gross or what. So I apologize for those who are offended. For those of you who are, you know, amazed at the consistency, I just want you to know I'm doing it for you. So my pre-op appointment that my husband will go to will be on the 17th. I will be receiving a call in the next couple of days from the hospital. They will set up the actual hospital tour and that kind of stuff. So we'll be able to go through, you know, the hospital and kind of see how, you know, what to expect on the day of surgery there at the hospital, where we'll go and everything. And then the surgery on the 29th, I can't believe it. I just kept thinking, I called my mom first thing. My husband was so excited for me. And then I called I called my mom, and she said, "Carrie, just think, this is going to be a brand new summer for you." And I just can't stop thinking about the fact that even though I'll only be like 3 months out by summertime, it's going to be the most new summer I've ever experienced. I will never have experienced a summer like this summer. I just can't even wrap my mind around it. It's kind of awesome. It's really awesome, and I'm really excited. So I just couldn't wait to share it with you guys. And feel free to, you know, ask questions if you have it, or tell me how excited you are for me, and I'll be happy to do the same for you. Thank you guys so much for all of your support and your well wishes and your wonderful comments, and the love that I'm receiving from the YouTube community. It's just great. So you guys have a great week, and I will fill you in probably after the 17th, after my pre-op visit with Dr. Callery, and I'll give you guys kind of an update of what goes on there. So, alrighty guys, I will talk to you soon. I love you all. Bye.